What's going on, everybody? Good morning. It is Kyle Summers, your licensed motherfucking bro therapist. And it's Monday morning, y'all. It's a beautiful morning outside. Man, I'm just feeling it today. And this video is, again, a response to Facebook post that I made about what's on your mind, what can I help you out with. And somebody commented about how to cope and how to live with borderline personality disorder. So, I'm not going to go into everything that goes into borderline personality disorder, but it is a mental health diagnosis that's marked by ongoing patterns of emotions and behaviors where the most telling thing is the frequency and the intensity in which they feel very strong, very painful emotions. You'll typically see this individual have difficulties with relationships in their life. There'll be a lot of conflict. There can be a strong fear of abandonment, fear of being alone. And sometimes this individual can struggle with a strong sense of self and who they are. And to live with it is to understand it. So first and foremost, understand what it is, and that it's not what you're going through is not because of some kind of individual deficit. There's nothing wrong with you. There's nothing inherently wrong with you. This is something that you experience. It's not who you are. First and foremost, the approach I take with individuals such as this is something called dialectical behavioral therapy. And so there's lots of strategies and methodologies, everything that go into it. But the most important thing is to not fight these strong and intense emotions. So everybody has a strong emotional reaction to stuff, right? We all got our triggers. And to understand what it's like with someone who's diagnosed with borderline personality disorder is take that strong emotion that you feel when it's like at its peak and multiply it by about 10. And that's what they feel. And something that can happen as a result of somebody that's experiencing that is they will turn to substances, alcohol, drugs, all kinds of things to minimize the emotional feeling because it freaking hurts. And then that can just compound the problem, but it's an escape from real pain. And so dialectical behavioral therapy, DBT, is a method that I use that teaches an individual to not fight these emotions, is to learn how to be present with them, validate themselves and that they're experiencing it, and learn to accept it in a sense, because if you fight it, it will only get worse. You criticize yourself in the moment of having emotions or whatever the situation is, those rampant thoughts will make the feeling stronger. And so being present in the moment, mindfulness is a big key to helping an individual that's been diagnosed with borderline personality disorder. The biggest thing that I also try to instill in individuals that I work with is there's no cure. There's no you're going to just stop experiencing these intense ranges of emotions. You're going to not experience triggers. You're not going to go through episodic relapses or whatever. It's something that's a lifelong thing. And so ongoing support. That doesn't mean you need to be in therapy all your life. Doesn't mean you have to be on medicine. Medicine can be helpful, but just to help with some of the symptoms that accompany it, like depression, anxiety, and whatnot, but their medication itself is not the number one treatment protocol for individuals such as this. Therapy and just ongoing support. Ongoing support where you continually have an outlet for what you're going through, understanding your triggers, and when you're in a relationship, having a supportive partner that understands you, that isn't going to criticize and judge you for what you go through, because those kind of things just kind of compound where the fear of abandonment and how much it can hurt to be vulnerable with someone else causes a lot of push and pull in romantic relationships. And so having a supportive partner is paramount. And so your partner needs to be active in that support and in that treatment with you, so that way it can give you the best chance. Yeah, so again, I hope this video helps. There's a lot of information to unpack about borderline personality disorder. I'm myself not an expert, I wouldn't say, but it's something I'm well versed in, and I've worked with a lot of individuals, and I believe I've been successful with it. But it's, I know enough to get me by, but you definitely want to continue seeking out experts and additional information. Definitely. I love the question. I hope this video helped her. Anybody else that watches this that's experiencing this or knows someone who is, hey, just if you liked it, share it with a friend. Comment down below, like it, go to my YouTube channel, do whatever it is. Just keep supporting me. I appreciate the heck out of it. I love you all. Have yourself a fantastic Monday. Peace.